Now we are going to discuss the lymphatic drainage of the breast और फिर उसकी clinical correlations और important points. Okay. So first of all हम ये वाली पिक्चर लेते हैं. See here. Now lymphatic drainage of the breast is very important. And ये आप लोगों को बहुत अच्छी आनी चाहिए. Okay. इसमें कोई गलती नहीं होनी चाहिए. No error in lymphatic drainage. So first of all देखें. नंबर 1 हम पहले लिखते हैं इसकी एनाटॉमिकल lymphatic drainage of the breast. Okay. Then there is another classification of lymphatic drainage in relation to this muscle, that is known as pectoralis minor muscle, and that is known as Berg's classification. Okay. So दो classification of lymph nodes you must have to know. Number 1, anatomical classification. The anatomical classification, see here. You have anterior axillary lymph nodes. Okay. यानी कि first of all we are going to explain in detail your axillary lymph nodes. Okay, main you can say the main drainage from the breast, it is going into your axillary lymph nodes. Okay. So axillary lymph nodes, it is your main drainage of the breast. It is going into your axillary lymph nodes, and you can write it that up to 75% of the or you can say majority of the lymph, it is going into your axillary lymph nodes. अब हमने इस breast को divide किया था 4 quadrants में, like this. Okay. तो अब ये देखें, this is the upper lateral quadrant, this is the lower lateral quadrant, this is the upper medial quadrant, this is the lower medial quadrant. Okay. तो ये देखें, अपर लेटरल, लोअर लेटरल, अपर मीडियल, लोअर मीडियल. Now these lateral quadrants, they are draining into your axillary lymph nodes. They are draining into your axillary lymph nodes. So please remember, lymphatic drainage from the lateral quadrants, 70-75%, all it is draining into your anterior, into your axillary lymph nodes. The lymph drainage from the medial quadrants, they are going to drain into your parasternal lymph nodes. Parasternal lymph nodes. Okay. And some of the inferior quadrants, for example, these are your inferior quadrants, they can also drain into the upper abdomen lymph nodes also. या उसको आप लिख सकते हो inferior phrenic lymph nodes also. Okay. First, these points are important. Second point, axillary lymph nodes are important because you divide the axillary lymph nodes into 5 groups. Okay. We divide the axillary lymph nodes into 5 groups now. First one is the anterior group, posterior group, and the lateral group. Okay. अब देखें, anterior क्या है? Anterior, it is draining from anterior part of the trunk above the umbilicus level. ये तो आपका हो गया जी anterior. Posterior is draining where? Posterior is draining into the posterior part of the trunk, posterior part of the trunk above iliac crest. ये हो गया आपका जी पोस्टीरियर। लैटरल, इट इज ड्रेनिंग फ्रॉम योर अपर लिम्ब। ओके, ये आ गए आपके जी तीन ग्रुप्स ऑफ एक्सिलरी लिम्फ नोड्स, एंटीरियर, पोस्टीरियर, लेटरल। Anterior, please remember, in this diagram, this is showing here the anterior axillary lymph nodes. So these anterior axillary lymph nodes, it is draining from the anterior part of the trunk above the umbilicus. Okay. Then we have posterior. Posterior axillary lymph node, it is draining from the posterior part of the trunk above the iliac crest. अब पीछे रह गया आपका लेटरल एक्सिलरी लिम्फ नोड्स। लेटरल एक्सिलरी लिम्फ नोड्स आर ड्रेनिंग फ्रॉम द अपर लिम्स। इट इज ड्रेनिंग फ्रॉम द अपर लिम्स। ओके, तो ये अपर लिम्स से ड्रेन करते हैं। ओके, नेक्स्ट पॉइंट, all these three together they are draining into your central axillary lymph nodes। ठीक है, these are your central axillary lymph nodes। Central axillary lymph node, this one, central axillary lymph nodes. So they are draining into the central axillary lymph nodes, and now the central axillary lymph node, it is draining into your apical apical lymph nodes. Your apical lymph nodes, they are present around your supra, ये देख रहे हो ये, it is present around your supraclavicular region or around the clavicle bone. This is your clavicle bone. Here also supraclavicular region. तो देखें, अब ये पांच ग्रुप हैं आपके एनाटॉमिकल, योर एक्सिलरी लिम्फ नोड्स, फाइव ग्रुप, anterior, posterior, lateral, anterior, posterior, lateral, all three are draining into your central axillary lymph nodes, which are present in the apex of the axilla. And from the central axillary lymph node, they are draining into your apical axillary lymph nodes, which are present around your clavicle bone, supraclavicular region. Okay, so this is your what? This is your anatomical classification for axillary lymph nodes. But see here, because mainly I explained to you that the breast cancer is mainly involving your lateral quadrants, and mostly it is involving the upper lateral quadrant. So mainly your drainage is in your axillary lymph nodes. So when axillary lymph nodes are involved, you must have to remove these lymph nodes. तो ये तो है सारा anatomical. But when you are performing the surgery, it is very difficult to differentiate that it is apical lymph nodes, central lymph nodes, or it is, you can say, anterior axillary lymph nodes or posterior axillary lymph nodes or your lateral axillary lymph nodes. It is very difficult to differentiate between all of them. तो उसको, to make it easy, surgeons make their own classification known as Berg's classification. And that Berg's classification, it depends upon this pectoralis minor muscle. This is your pectoralis minor muscle. And in this relation to pectoralis minor muscle, now you are going to divide the lymph nodes. Now the lymph nodes, see here, this is your pectoralis minor muscle. Okay, so see here, if they are lateral to your pectoralis minor muscle, you will call it as level 1 axillary lymph nodes. और level 1 में कौन कौन से आते हैं? Your anterior, posterior and your lateral axillary lymph nodes. If the lymph nodes are present in this range, in the, यानी कि pectoralis minor muscle के पास होंगे और in the deep layers of the pectoralis minor muscle, then it is your level 2 lymph nodes. Okay, so level 2 lymph nodes are your deep lymph nodes, or you can call it as your interpectoral lymph nodes. Interpectoral, between pectoralis minor and pectoralis major muscle. And these deep interpectoral lymph nodes, they are also known as Rotter's lymph nodes. according to author name. Rotor's lymph node. Third one is your level 3 lymph node, which is medial to your pectoralis minor muscle. And that is your which lymph nodes? That is your apical lymph nodes. And apical lymph nodes are also known according to author name Halstead lymph nodes. Yeah, Halstead lymph nodes. Okay. So these lymph nodes are very, very important. Again, I am explaining to you. See here. Burst classification is make so that you can easily understand these axillary lymph nodes. Anatomically, axillary lymph nodes is having 5 groups. Anterior, posterior, lateral. Anterior from the anterior part of the trunk above the umbilicus. Posterior from the posterior part of the trunk above the iliac crest. Lateral, it is draining from the upper limb. Okay. Then, second important point. All these 3 groups, they are draining into the central axillary lymph nodes, and central axillary lymph nodes which are present in the apex of the axilla, they are now draining it into your apical lymph nodes which are present around your supraclavicular region. Apical lymph nodes around your this region. Okay, so this is anatomical, you can say, grouping of your axillary lymph nodes. Okay, but if you want to study the Burke's classification, which is for the surgeons to make it easy for them, they make it in relation to pectoralis minor muscle. This is your MCQ. They can ask you Burke's classification of axillary lymph nodes are in relation to which muscle. Your answer will be pectoralis minor muscle. Okay, so this pectoralis minor muscle, see here, if the lymph nodes are lateral to pectoralis minor muscle, level 1 lymph nodes. If the lymph nodes are present here behind the pectoralis minor muscle or in between this pectoral muscle, it is known as level 2 lymph nodes. If it is present medial to pectoralis minor muscle, it is known as level 3 lymph nodes. तो लेवल 1 में कौन कौन से हैं? एंटीरियर, पोस्टीरियर एंड योर लैटरल लिम्फ नोड्स. लेवल 2 में कौन कौन से हैं? डीप इंटरपेक्टोरल लिम्फ नोड्स आर आल्सो नोन एज रोटर्स लिम्फ नोड्स. Level 3, it is your apical lymph nodes or also known as Halstead lymph nodes. Okay, so this is clear to everyone. तो यहाँ पे सिर्फ एक और पॉइंट ऐड करूंगा, that is your sentinel lymph node. Sentinel lymph node. So what is sentinel lymph node? The first lymph node, the first lymph node to which the cancer cell is spread is known as sentinel lymph node. Okay. For example, tumor or cancer is in the breast region. Now it is spreading into the lymphatics. And the first lymphatic which is going to involved in the cancer, that is known as sentinel lymph node. Okay. That is known as which lymph node? Sentinel lymph node. Clear to everyone? So lymphatic drainage is clear to all of you. This is clear? Yes. Okay. So see here. This is your lymph nodes in relation to pectoralis minor muscle. Level 1, it is lateral to pectoralis minor muscle. Level 2, it is behind your pectoralis minor muscle. And medial, it is your level 3 lymph nodes. Okay. So these are very, very important for your breast cancer staging. Okay. So please remember these lateral quadrants are draining into your anterior axillary lymph nodes. Your medial quadrants, they are draining into your parasternal or these interthoracic lymph nodes. Okay, parasternal lymph nodes. Okay, so these are the points which you must have to remember: anterior, posterior, lateral, central group, and the apical group. Okay, Clear to everyone? Now I want to show you some breast imaging things. Now see here this one. In this is known as PUD orange. So what is PUD orange? PUD orange, it is when the cancer is involving your subdermal lymphatics. It is known as PUD orange, orange peel-like appearance. Now see here, this is the breast tissue and there is dimpling of the skin. This dimpling of the skin, it is due to the involvement of the Cooper's ligament. I already explained to you. So if the cancer is involving the Cooper's ligament, the suspensory ligament of breast or suspensory ligament of Cooper, there will be dimpling of the skin. If the cancer is involving the lactiferous duct, there will be nipple retraction. And please remember, nipple retraction can be of two types. It can be circumferential retraction, it can be slit-like retraction. If it is a slit-like retraction, it is a patient of duct ectasia. If it is circumferential, then it is a patient of your cancer. Okay? So these are your important points in relation to the breast. I hope it is clear to all of you. Okay? Clear to everyone?